In this lesson, we're going to look at why we document and how laws affect our documentation. So when we look at documentation, the first thing that we want to stress and that we want to recognize is that any of the charting that you do is actually part of the patient's medical record. So patients can always see what's written, and they can make sure that the care that you provided to the patient was accurate and that it reflects it in the medical record. The other thing that the medical record does is it communicates information between healthcare providers. So a doctor can see when a Foley was discontinued or when it was placed. They can look at your assessments. They can look at your dressing changes, stuff like that. So by doing this, it actually helps to reduce delays in care. When we document, we want to make sure that we're documenting in real time. So what does that mean? It basically means that when you chart your care, you want to chart it as close to the time that you actually gave the care as possible. When you do this, you actually reduce gaps in memory. And by doing so, you reduce the possibility of putting inaccurate information in the chart. There's great information on documentation basics and documentation pro tips. So go check those lessons out. But the big takeaway here is that you want to document in real time whenever possible. When we talk about documentation, there are things that you absolutely do not want to do. And the first of these is charting in advance. When you chart in advance, you're essentially predicting the care that you're going to give. And sometimes that just doesn't match up. And oftentimes it doesn't match up. So you never want to say what you're going to do. Always write retrospectively, meaning that you document the care that you actually gave the patient. So let's use an example. Let's say your patient has 2 IVs and they both work. Let's say one of them fails and you go and chart that you changed one, or that you placed a new one in one location, and let's say something happens and it's not right. Well, the medical record is going to reflect inaccurately against the care that you actually gave. So what you want to do is you want to make sure that you chart after you gave the care. The second thing that we're going to look at is charting under somebody else. You don't ever want to chart under someone else's login or their name. It's just misleading, saying that one nurse provided care when actually another one didn't. Just don't do it. The last thing that we're going to talk about is changing someone else's documentation. Look, I get it. You've got friends on the unit, but you never want to go back and change documentation. What ends up happening is, let's say something bad happens to a patient and you've altered somebody else's documentation. It presents a liability to you. It presents a liability to the other nurse. So the onus is on that person to make sure that their documentation is correct, as is yours. So make sure that your charting is totally 100% meticulously correct and accurate. And then don't worry about anybody else's charting, because that's on them. And you never want to go help out a friend by changing someone else's documentation. Another big thing that we look at are the legal implications of documentation. So things like lawsuits. Medical records can often be pulled during lawsuits. So let's say you have a patient that had a bed sore on her leg and it turned into an amputation, and she decides to sue the hospital. Well, what ends up happening is they'll look at the care that was provided. So you want to make sure that you meticulously chart everything that you did and that you are completely 100% in compliance. So make sure that you, number one, follow policy of the hospital in terms of charting. But the other thing is just to make sure that you document everything, because at some point it may be pulled for a lawsuit. The other thing is auditing. Audits occur in the hospital for quality assurance and quality improvement. And senior leadership will often make sure that they're in compliance, and they want to make sure to look at things like barcode scanning, or which is also known as BCMA. So they barcode medication administration. And what that is they make sure that you're scanning the patient and that you're scanning the medication, and they want you to reach a certain percentage. Let's say they want you to be 90% compliant. They'll actually make sure that you're doing that by looking at the medical records. The other thing about this particular arena of information is that medical records are often subject to review. So the Joint Commission and the CMS want to make sure that you are being compliant with their regulations, because hospitals can lose accreditation, and you want to make sure that any of the care that you're giving is consistent with those regulations and the rules that they've put on that particular hospital for whatever reason that they may be. So make sure that you follow the policy of your hospital when it comes to the Joint Commission and CMS. Now, quickly, here are some nursing concepts associated with the legal aspects of documentation. So you've got ethical and legal practice, you've got professionalism, and you've got health information technology. All right, so let's recap. Number one, any of your charting is part of the medical record. Your patients can see what you document, so make sure that you're truthful and accurate with the information that you put in. Number two, chart in real time. Make sure that you're charting as close to when you give the care so that it reduces errors and omissions. Also, be truthful. So don't chart in advance. Don't chart under someone else's name. Don't go change your friend's documentation. That's a quick way to falsify information, so don't do it. Remember, medical records can be subject to lawsuits and audits, and they can also be subject to review. So documentation can be subject to review by CMS and the Joint Commission. So make sure that you're always adhering to the regulations of these two groups and also your hospital policy. So guys, that's it for this lesson. Make sure you check out any of the resources attached to it. Go out and be your best selves today. And as always, happy nursing.